Welcome everyone to today's workshop, The National State of Mental Health and Promising Local Efforts. This is part of the 71st Annual All-America City Awards, which are actually being held virtual for the first time this year. My name is Rebecca Trout, and I'm the Program Director for the All-America City Awards here at the National Civic League. We're very excited for today's workshop, which is all part of our 2020 theme for this year, Enhancing Health and Well-Being Through Civic Engagement. We are joined by our wonderful panelists today, Dr. Ben Miller, Chief Strategy Officer with the Wellbeing Trust, Jonah Cunningham, Government Relations Manager for Trust for America's Health, Dr. Octavio Miller, Executive Director, Hog Foundation for Mental Health, and Lorez Meinhold, Executive Director for Caring for Denver. Excited to get everybody's thoughts and wisdom shared today. So without further ado, I'm going to hand it over to Dr. Miller with the Wellbeing Trust. Ben?
Wonderful. And just so people don't think that Octavia and I are related, it's Dr. Martinez.
Oh, I'm so sorry.
It's all good. All right. So I will now share my screen here and try not to embarrass myself in front of the countless thousands that are watching this right now. All right, here we go. Awesome. Okay, thanks, Rebecca, and thanks to you all for joining us today for what I think is an important topic for us to cover. I'm going to try and level set at the national level what's happening with mental health in this country, and I'm going to try and do it in 10 minutes or less. So there's a lot to be said, and I'm going to speak quickly, but I really want to start with this moment. Because what COVID has done is it's really almost increased our understanding of what mental health is. It's allowed for us as a nation to begin to have conversations with one another that we didn't have before COVID. Because whether or not we realize this and embrace this, we're all experiencing change and disruption at a substantial level in our lives. And for me, I think if the best thing that could come from COVID is empathy, then maybe we count that as a win and move on. Because we truly are understanding the challenges that people face day in and day out, those that might have to put their lives at risk to go to work, those that have lost their jobs and are trying to figure out a way to pay for their family. This is a moment, and I think it's a propitious one, where we actually should be questioning what works and what doesn't work in this country. So what I want to focus on today is what hasn't worked, and then give us an opportunity to then pivot to obviously Jonah, who will tell us what we should be doing to make things work a little bit easier. In partnership with Jonah's team at Trust for America's Health, Wellbeing Trust has been releasing a series of reports with TIFA called Pain in the Nation. And these reports simply highlight the fact that our country has been moving in the wrong direction for deaths of despair. For those of you unfamiliar with this term, it was coined by some economists really looking at the last economic downturn when we saw an increase in deaths to drug, alcohol, and suicide. And as you can see here on the slide, we keep getting worse. If the slide is moving, we keep getting worse in this nation. So let me show you the next slide, which is actually better. There we go. And in 2018, we lost 151,000 lives to drug, alcohol, and suicide. And that was actually one of the first times that we saw the drug overdose deaths begin to flatten, and it actually decreased in some communities. The problem is that alcohol deaths and suicide kept going up. And the bigger problem, which you can see here on this next slide, is that when we got preliminary data from the CDC from 2019, we actually saw a 5% increase in deaths to drug overdose. So it meant that our momentary success was indeed momentary, and we're still going in the wrong direction for what's plaguing so many folks who have issues of addiction in this country. Just to put this in a little bit of perspective, the deaths from drug overdose remain higher at the peak yearly death total ever recorded for car accidents, guns, or AIDS. So we're losing folks to preventable causes, and we can be doing so much more. Well, what is it that we actually need to be doing? Well, that's why we, in partnership with, or collaboration with Kaiser Family Foundation, have created a series of state-specific reports that you can go to find out how well your state's doing for mental health. And I would encourage you to do this because not all states are doing great. But what we intend for this is for it to become a call to action. So if you're in a community, let's just say you're in my state of Tennessee, and you feel like there's more that could be done to advance mental health, you can go and compare, well, how well is Tennessee doing to Georgia? And if we're talking about football, maybe not so great, but if we're talking about other things around health access, maybe we're doing better. And so it gives us a moment to really reflect on some of these data. And I'll give you an example of a data point that you can find on the website. If you look at June of 2019 and you compare it to June of 2020, we actually saw a 25% increase in the number of folks who are reporting symptoms of anxiety and depression. That is a massive uptick, a massive uptick. And the reasons that I think these data are important is that you can track them over time, but they also give us one of these amazing things that we in the policy world like to have, which is a talking point. And talking points plus your story lead to change. And we think that that's one of the areas that we're going to have to focus on as a nation is data and stories. But because we had this epidemic within the pandemic, because we were losing lives to drug, alcohol, and suicide at ridiculous rates, colleagues and I got together and we said, okay, well, what is it that could make things worse? Well, COVID obviously is going to make things worse. How bad could it make it? And on the slide, you can see here projections that we've made. These are just projections. They don't mean that they're going to happen. We hope that they don't happen. But they're based on how quickly our economy will recover and how quickly jobs will come back. So you can find the report online, but you can see here on the slide that the deaths could be anywhere from 27,000 all the way up to 154,000. And these are additional deaths of despair on top of the deaths of despair that we were already seeing. So what this slide should tell you is that our country is facing a major problem right now that requires urgent solutions. Here's the link to the report so you can actually see this. We break it down by county. You can go and look at your state. You can see how many additional deaths you might achieve over 10 years due to drug, alcohol, and suicide. It gives you, again, a moment to talk about what we could potentially move towards for solutions. So what we've done with these data is that we've created opportunities for states to see that this is a moment for reflection around reform. That if we're going to respond and recover from COVID in new ways, we actually do need to examine what wasn't working. And on the slide you see here in front of you, these are actually slides that we pulled together for California. And we did it for every county so that you can see this one's particular to Napa County, that how many additional deaths Napa County might have if we didn't do anything different around deaths of despair. Now, what's interesting is that deaths of despair were already a problem, as I said, but these, for some reason, COVID has increased the urgency in states, especially legislators, to talk about these issues and what are we going to do. Now, ironically, we're cutting state budgets because of the downturn, and Medicaid and mental health go hand in hand. So we are seeing some shifts there, which is a bit unfortunate. So some policy recommendations that we've been discussing, and I know Jonah is going to go into more of some of these, is that we think that there is immediate opportunity in this nation to really embrace change specifically around telehealth services. If you've experienced this right now, and maybe many of you have, where you've been able to talk to your doctor on the phone and you get to use FaceTime or you get to use some other application that you didn't use before, it's because we've loosened some of the privacy restrictions on what's allowed. Now, what's great is that we could actually make some of these permanent. And so some of the immediate policy recommendations are to make it permanent, where people can get paid to use their phone to talk to you just as much as they could if you were a face-to-face visit. That's a game changer for folks that live in rural communities. That's a game changer for folks who may have to take time off work or away from their kids so that they can actually talk to a clinician. In addition, we're looking at all these folks that are being sent out of prison, out of jails, because we know that COVID unfortunately does not do well when it's trapped inside doors, and folks that are incarcerated are at higher risk for potentially developing symptoms from COVID. So we need to look at that, but while we're looking at that, let's consider providing some type of coverage 30 days prior to an individual being released. There's an amazing piece of legislation in Congress right now where this is being discussed. What does this do? Well, we know a lot of folks that are incarcerated are oftentimes incarcerated because they have underlying mental health and addiction. And when we don't address those and we simply turn them back on the streets with no coverage, we're not giving them a fighting chance to be successful. Third, we got to put cash into the pockets of providers, especially Medicaid providers. Fourth, we've got to consider how to fully fund this 988 hotline, which is the new 911 for suicide prevention. And then five, we have to examine our current structures to find out what's going to really allow us to truly succeed on integration in this country. I'm going to wrap up here in 2 seconds. Wellbeing Trust has gotten behind a product that we call Healing the Nation. And in Healing the Nation, it's a series of policy recommendations for the federal government that build off of this, a framework for excellence around mental health and well-being. And I won't say much about it other than to say that we believe that any policy that limits where a person can get access to mental health is a bad policy. That we've got to consider ways that we can open up the doors for individuals to be able to access it in a school just as easy as they could a mental health center. When we look at criminal justice reform, if we don't take into account how criminal justice reform connects to the health sector, we're missing an opportunity for reform. So for only the courageous visionaries do I show these last two slides. These are examples of big policy that could make a huge difference. What happens if we create a new structure that really does accommodate integration, that does the thing that I just talked about? That actually could be transformative for our communities. At a city level, we actually could do this a lot easier than we could at the federal level. But it forces us to examine the barriers and those inherited structures that we've all been given. Second of all, let's rethink workforce. It's a tremendous moment right now for us to rethink workforce and get outside of these traditional silos of clinical delivery and licensed clinicians and begin to really almost embrace the fact that all communities should have competency for addressing mental health and addiction. And then third, and this is something that I know we'll hear a little bit about today, what happens when you infuse cash directly into the communities that have solutions for these problems? It's a radical idea, especially when you consider the federal government and the role the federal government might play, but it actually might be the best idea because too many top-down policies and programs have not been proven to be effective, as I showed you at the top of my slides around opioids. Local communities have major solutions that they could pursue if they just had a little bit of funding. So in closing, this is a really unique moment, and I would encourage each of us, aside from the big policy recommendations and a lot of the amazing opportunity for us to pursue reform, let's don't lose sight of the fact that this is a moment for us to turn to each other and to talk about mental health in new ways. If we're not able to have some of those awkward conversations, we're sure as heck not going to be able to see major reform because we've got an opportunity here to change the way socially we interact around mental health and structurally how we deliver mental health. Thank you so much.
Thank you, Dr. Miller. I appreciate you giving us that sort of bird's eye view there and love the way you framed it as an opportunity for us to look at this differently moving forward. Now going to welcome Jonah Cunningham, who will be talking about some of the more specific policy recommendations. Jonah?
Perfect. No, I have to land the triple axle right now, sharing the screen. Let's see, there it is. Perfect. So, hi everybody, Jonah Cunningham, Government Relations Manager for Trust for America's Health. Some of the stuff I'll highlight kind of dovetails with Ben. So first off, Trust for America's Health, we're an independent, nonpartisan public health and prevention think tank with an advocacy arm. We just produce a number of reports. Ben's already mentioned Pain in the Nation. We have a state of obesity report, a public health funding report, Ready or Not, that came out actually right around the time early this spring, kind of fortuitous timing, but really bad timing, rather not have a pandemic. We received no federal funding, no industry funding, so we try to really be evidence-based in our recommendations. As Ben mentioned, we co-authored the Pain in the Nation report, started in 2017, focused on the triple epidemic or the deaths of despair. Released a number of briefs focused on different systems, education, healthcare, as well as different populations like the millennials or the adolescent youth. I'd also just put in a plug for the Healing the Nation report. It's a great report looking expansively, as well as the recently published Springboard for Resilience and Recovery post-COVID. So before I dive into policy and policy recommendations, I wanted to start with a refresher. I think we all remember the Schoolhouse Rock, I'm just a bill up on Capitol Hill. Unfortunately, in reality, bills are much less entertaining. And also the levers in which to enact policy change are vast and diverse. Of course, they're across the three different branches of government, legislative, executive, or also referred to as the administration, and the judicial branch. For this presentation, I'll really focus on the legislative and executive actions around COVID. Just to review, the one responsibility Congress has every year is to pass 12 appropriations bills to really keep the lights on and to make sure that policies and programs, the monies are going out the door, the programs are running smoothly. They can also do oversight. They can establish rules. They can also punt the rules back to, say, the FDA. We pass a bill for the FDA to establish a rule on XYZ. The executive branch, they can do, again, promulgate rules, which have the effect of law. They can do executive orders. And they can also do, the third one, again, I'm doing a third one, but those are really the two buckets. So when COVID happened, there were really three things the executive branch did. First, they changed telehealth regulations to allow for, instead of totally virtual, where you have to have a video link, you can do now audio only. Additionally, they simplified the patient privacy rules. So HIPAA and 42 CFR. 42 CFR covers substance use services and how you can share that information. There's been a huge debate the last few years on how this information is shared, and that was simplified. Also, they've eased the regulations surrounding substance use treatment. For example, there's take-home treatment for stabilized patients. There is a proposed rule from the DEA for allowing mobile components for medically assisted treatment programs, so you can actually go into neighborhoods, reach out to patients who need help. But a lot of this action isn't restricted to the executive branch. The legislative branch, or Congress, has passed technically 4, but in DC, for whatever reason, we call it 3.5 bills to really address COVID. The one relevant to our work appropriated $425 million to the Substance Abuse Mental Health Services Administration. Of course, these bills were expansive. They're trillions of dollars they threw at holding up the economy. So the Small Business Administration with the PPP loans. HHS also had provider relief, billions of dollars there. But for SAMHSA, they got a little chunk of money. So $425 million, $110 million for emergency grants to providers, $250 million for certified community behavioral health clinics or outpatient treatment, and $50 million for suicide prevention. Additionally, SAMHSA and CDC have issued a number of technical assistance packages. They've hosted webinars, they've done outreach, they've issued guidance. But again, small fraction of money when the need is so massive. So I should say today, as of July 31st, there's a lot of debate and there's a lot of action happening. So the House has presented their HEROES bill, the democratically led House. The Senate Republicans have released their HEALS bill this year. They're worlds apart. There is no deal. I was hoping there was, I could announce it for this. There's a lot of holdups when it comes to liability relief, when it comes to enhanced unemployment. But one thing I wanted to flag is both bills have massive amounts of money when it comes for SAMHSA. The HEROES Act in the House has $3 billion for SAMHSA for its work, appropriated through different programs. It's important, the context, SAMHSA's top line funding right now is $6 billion. So it basically be a huge infusion of money, really bolster their programs. While the Senate HEALS Act is $4.5 billion, with $1 billion going specifically to providers. Again, worlds apart, we'll see where they land on that supplemental appropriations bill. Also in the thick of things is for fiscal year 21, the appropriations bill. Remember, they have to pass 12 of these bills on all different parts of government. The one relevant to our discussion is the labor HHS bill, which the House just passed their version today. Breaking news, July 31st. However, it's basically dead on arrival when it comes to the Senate. The president has already threatened to veto. The Senate Republicans will probably not take it up. My guess, if I'm looking into my crystal ball, we're looking at a series of what are called short-term CRs, continuing resolutions, basically funding the federal government at its current levels. Also, I wanted to flag one programmatic, not necessarily debate, but action. So as been mentioned, the Suicide Prevention Lifeline, there's been a movement to change it from its current number, 1-800-273-8255, to a 3-digit number, 988. The FCC just passed a rule setting up the transition over a 2-year period. Additionally, there's a piece of legislation in the House by Congressman Chris Stewart and Seth Moulton that would speed up this transition to 1 year to that and also allow states to have user fees, or basically giving it money to help fund that transition. Of course, that bill needs to be passed by the end of this year, by the end of this Congress, or else, like Cinderella, it turns into a pumpkin. Well, Cinderella's carriage. So we've talked about kind of the jumble right now. We've talked about kind of the outlook on the hill, where there's still a lot of things to be resolved, and we're still in the thick of things when it comes to COVID-19 and its effect on mental health. Some of the future considerations, some of the debates are surrounding making the telehealth rules changes permanent. There's been a number of bills, I would say roughly a dozen bills, to allow for virtual only, to allow for reimbursement rates to be equal to in-person. And depending on where we end up, I expect there to be some type of action to make it easier to access, especially behavioral health services, when access to care is so difficult. Additionally, I mentioned the proposals for provider funds and the $110 million for emergency relief. There's a big push for behavioral health provider relief. A report by our friends at the National Council for Behavioral Health back in April found over 40% of providers had to furlough an employee as a result of COVID. The struggles are still continuing. There's been difficulty accessing those provider relief funds from HHS or the PPP funds from the Small Business Association. If we want to really address these issues, and if the numbers continue to look bleak in 2020, we need to make sure that the providers are there to service people. And lastly, I also want to just flag the debate when it comes to the supplemental appropriations bills also includes state and local support. I wanted to flag the Medicaid program, since there was an enhanced FMAP, or federal matching, of the total funding for Medicaid of 6.2%. Now, there's been debate to increase this anywhere from 12 to 14 to help really shore up the funds that states need to provide services for people under the Medicaid program. And while it's relevant to our discussion in mental health, is that Medicaid is the #1 payer for mental health and substance use services. They're often the provider of last resort for people. Ben mentioned people transitioning out of correctional facilities and the need to make sure that they have access to the mental health and substance use care that they need. Now, where this ends up, we will see, but if there's one thing I wanted to leave everyone with, as a former staffer, and I've seen this work in real life, is the power of advocacy. If there's something in here that I've mentioned, whether it's telehealth, access to care, please call up your federal official, your local official, your state official, and advocate for it. You'd be surprised how far a phone call, a letter, even a teletown hall can go. So please, please, please be involved and vote in November. Thank you.
Sorry, guys, I was muted there. Thank you, Jonah. I appreciate the civics lesson, as well as helping us refresh us on our current affairs here. I'm going to go back and watch some old episodes of Schoolhouse Rock now. Now that we have a good view of sort of the national picture, as well as some important policy that's in the works right now, I want to hand it off to Dr. Martinez, and he's going to talk to us about some of the work going on at the Hog Foundation down in Texas. Dr. Martinez.
Thank you, Rebecca. Bring up the slide here. Turn it into a presentation. Okay. So first off, let me thank the National Civic League and also Rebecca for that introduction and the wonderful presentations by Ben and Jonah to set things up for us. Just for those that aren't familiar with the Hog Foundation for Mental Health, we're here in the great state of Texas. We've been around since 1940. We're part of the UT system. However, we don't get any general revenue. It all comes from endowments, mostly from the Hog family. And as you can imagine, it's old oil money. And we're a statewide funder. I'm going to concentrate a little bit on, as you can see here, on how it's impacted populations of color, especially Black, Latinx, and Indigenous. And Texas is no different than the rest of the nation, how this pandemic, in fact, has truly exacerbated the deep-seated inequities that already existed before COVID-19 that many of us have been working on in trying to achieve health equity for all. And as you can see, or have heard, I'm sure, Texas did not expand Medicaid, and we've always had the highest number of uninsured. And this is making things worse, the pandemic. As you can see there, this comes from Mental Health America Dallas, a good colleague there, Bonnie Cook, shared with us recently since January of 2020, 660,000 have lost health insurance from their employer base here in the state of Texas. And from all indications, it appears that now we're at an extremely high rate of uninsured, where 29% of Texans are estimated to be uninsured. And we know how important insurance is just for access, let alone some other issues that come along with care itself. And as you can see here, for our Black, Latinx, and Indigenous communities of color, they've always had lower access to mental health and substance use treatment. And this is definitely making things worse. And it's bringing in much more folks across the board that are experiencing not being able to access treatments. The other thing that is really important that has become evident is who can work from home and who cannot. And many of our communities of folks that are communities in color, but also rural folks and just folks in general, aren't able to work from home and are in service industries where they're considered to be critical. And so they're having to continue to work and to be exposed to COVID-19 and its implications to themselves personally, their family, and their community. For certain groups of our populations, they live in multi-generational, low-income, or public housing, or here in Texas, colonias. In colonias, for those that aren't aware, there's a great number of them along the Texas-Mexico border, but these are unincorporated housing areas, developments, and many of them don't have running water or even running sewage. In some of them where it's really dire, they also don't even have electricity. Surprisingly, the majority, like I said, are along the Texas-Mexico border, and there's colonias all the way to California, all the way to San Diego area. But surprisingly, there's even some throughout the rest of the counties of the state of Texas, even in Central Texas and in North Texas. And imagine how these folks are trying to respond to COVID-19 given those additional challenges. And unfortunately, the Black, Latinx, and Indigenous and populations of color have been dealing with already high rates of diabetes, asthma, hypertension, and obesity. And as we know, these are now risk factors for, in fact, if you were to get COVID-19, makes the illness very serious. And in fact, unfortunately, could also result in mortality, which is death, which is the worst outcome that can happen. The impact on behavioral health, though, is also very significant, as already has been mentioned by Ben and Jonah. But a national poll done by our American Psychiatric Association just recently shows that half of us are very anxious about contracting COVID-19, and 40% are very worried about serious illness or even dying from COVID-19. And it's understandable, because what's interesting about COVID-19, remember, it was started first as novel coronavirus, which means that it was new to everybody, including the science community, and we're learning all together as we go along. And unfortunately, I think that causes a lot of distress, because we don't have, when I say we, I'm talking about the medical and science community, answers immediately and in real time already prepared, but we're learning together. But that makes it very anxiety provoking. Getting back to Mental Health America Dallas, up in the Dallas-Fort Worth area, they have a wonderful online screening tools, and they've seen since January of this year, as you can see, huge numbers of increase in screenings for anxiety, over 497%, depression, up 495%, 95% in their screenings, and substance use screenings up 629%. Gives a good indication of a certain region here in Texas of how COVID-19 is truly impacting mental health. Also, there was a study put out by American Journal of Preventive Medicine that shows that, in fact, also discrimination is up. And especially when you look at our colleagues that are Asian American, I've heard of and know of actually personal Asian American physicians and providers, nurses and such in the Austin area at Dell Medical School, who in fact are on the front lines doing the hard work, but when they leave the medical setting and when they're going home and they're seen outside of their scrubs, find to have microaggressions and discrimination, insults thrown at them, which is very unfortunate, because these are folks that are putting their lives on the line for all of us. And also want to point out the trust issue that already existed prior to COVID-19. COVID-19 is just making it even worse. And a recent study that was just done here in Texas shows that there's an 80% distrust in the Texas Latinx community. And you can imagine what has contributed to that. The current political environment has lent a great deal to that, but it does impact how we respond or how that community is responding, where there's this low uptake on COVID-19 compliance. And another very important thing that's happening, this is also the year of the census. And so that also is impacted and has great implications, especially when it comes to the resources federally that are going to be distributed from a population standpoint to all of the states in the union. The Hog Foundation, how are we responding? Well, as a foundation, we're blessed to be able to have revenue to be able to help our communities. And so one of the first things we did was assemble the list of resources for COVID-19 and behavioral health. We chose 5 big categories, as you can see there: general, children, youth, older adults, caregivers, and then providers. We've informed our current grantees, which we thought, we're not a huge foundation, but one of the things that was important is we have a lot of grantees that have statewide impact. Let's support them and ensure that they're able to follow through. And so we contacted them and let them know that there was going to be a budget amendment, and we were increasing their overhead, which was usually at 10% to 20%, because it's really important for an organization to be able to pivot. But often, these are small nonprofits, some of them, and they don't have the wherewithal unless they're given that flexibility. And we wanted to ensure that that was actually happening, because no one knows community better than those folks that are on the ground at the community level. We also set aside, and we looked at our budget. We're strategic grant makers, so much of our budget's already assigned to a certain category, but we were able to pull down $1 million to be able to continue to support and to help pivot our current grantees. And so the funds were allocated to each unit to be able to do that with our partners that are out in the community. We also signed on to the Council of Foundations, which they were calling for an action for all of us in the nonprofit, in the philanthropy sector, to increase unrestricted giving and to provide maximum flexibility, which is a thing that fit with our vision, with our values. And so we wanted to sign on to show that we definitely were in this all together. Some of the responses that have been able to be done through that $1 million COVID-19 fund, as an example, is recognizing how it's impacting, unfortunately, the ability to actually feed your family. We've all heard and seen the lines on television, and Texas is no different. So we were able to fund 7 food banks representing 92 counties in Texas to be able to help provide food to families throughout those counties. As an example, the Children's Grief Center in El Paso, we've been able to fund them, because what we're seeing and what's happening is that adults are dying from this, but they're leaving behind children. And who's then going to take care of their kids? And family members can step up, but often they do need some support. There's also been another grief center up in Dallas that has contacted us, and we're hoping to be able to fund as well. Also like Broadband Project, which has come up in Bastrop, but now also up in Northeast Texas in Morris County, where we're helping them to be able to bring broadband. So as been pointed out by Jonah and also by Ben, it's been great to be able to expand the barriers to deliver services virtually, especially mental health, through telemedicine, telepsychiatry, and so forth. But broadband also kind of limits the ability, if the infrastructure is not there, for our community members to take advantage of this. So it's really an important project. Also recognizing that it's not also just about us, but it's about who provides our care, right? They are equally important. And so critical is this resource when you take a look at our doctors, our nurses, our social workers, community health providers, community health workers. It really is critical, because we lose one and it is a travesty, like unfortunately the loss of the Brooklyn ER doc who committed suicide. That devastated the whole medical community, and many us realize what a precious resource we have to ensure. So we partner with the Dell Medical School to be able to supply and support healthcare resources to our mental health workers. Also, pointing out that before COVID-19 and recognizing the importance of the census, we already had a grant initiative to be able to help our communities here in Texas to ensure that the hard to count communities were represented in our census, helping also for them to pivot. Can you imagine how hard it is to actually go out and do the census, which in many cases, yes, we're doing it more virtually now, where you just get it through the email. But we also know the hard to count communities still need that human touch. We need to be able to go out. And if you don't have the PPE, the personal protective equipment, and the ability and infrastructure to do that, we're going to leave those folks out of the count. And that is not fair to them, but also is not going to be fair to our governmental structures that so much need the resources to be able to take care of our communities going forward for the next decade. And also the Hog Foundation, as I mentioned, is a strategic grant maker. This obviously is going to influence us, i.e. COVID-19, greatly in how we decide how we're going to decide our next major grant initiatives, as it should. I just want to highlight this. I'm not going to go through all of this, but community engagement is critical to the work that we do and to be able to make an impact. And it is so important, and it is part of our value system and the way that we are actually doing our grants now here in the state of Texas, where we're really partnering at the community level. We have a rural counties community initiative, and we have one that's a metro one, and we're learning so much from each of those on how to, in fact, be much more, be a better partner, be support, ensure their voices at the table, so that in fact we come up with solutions that are coming from the community's perspective. I'll end on this, which is we also need to know what's happening from our colleagues and also from the great state of Texas, our Texas state government, and they also are responding. So they've created the COVID-19 mental health support line, 24/7, available for anyone and everyone to be able to call in. And also within that context, though, if you are actually a frontline worker, you can identify to actually get separate resources dedicated to you specifically, where peers, i.e. your own peers, medical peers and public health peers are there to be able to address and help how to respond to COVID-19 from a behavioral health standpoint. And then also there's the Crisis Counseling Assistant Training Program, the CCP, that's already existed. And here in Texas, it's called Texans Recovering Together. Here at Texas, it's administered within the Disaster Behavioral Health Services branch of the Health and Human Services Commission. They do some great work. Obviously existed before, especially for the hurricanes that have hit Texas recently and other traumatic events. But recently, $5.8 million funded through FEMA, because they're the ones that actually help fund CCP, to work with survivors of COVID-19. And it's to provide information, education, referrals, but also to coordinate with all our local mental health authorities that are throughout the state of Texas, because it really does take a village to be able to address this. So all of us working together. Thank you, Rebecca. And thank you, everyone.
Thank you so much, Octavio. I appreciate you and the work that's happening with the Hog Foundation. Great that you guys were able to increase both funding and the flexibility of that funding to support your grantees, and then also appreciate you tying in civic engagement in there at the end, which is definitely speaking the league's language. And now I'm going to hand it off over to Lorez Meinhold, who's going to talk to us a little bit about the work going on at Caring for Denver. Lorez?
Thank you very much. Really appreciate all the work that's going on, and both from and this viewpoint is even helpful for me. I can get super focused at the local level, and so it's great to hear again how the national efforts are tying to the conversations that are going on at state levels and in local communities. So I am the executive director of Caring for Denver Foundation, and really thanks to the National Civic League and my esteemed colleagues on the panel, really to helping set the stage. Similar to the National Civic League, we believe that community engagement is key to achieving success on really tough issues. And in Colorado specifically, and in Denver even more specifically, we believe community engagement is critical to achieving that success in mental health and substance misuse. Ben talked about innovation coming from community, and we couldn't agree more. That is really the premise of who we are. So a little bit of our history, we were created out of a ballot initiative. We raised sales tax in the city and county of Denver by 0.25%. So for every $100, 25 cents comes to Caring for Denver Foundation. It passed with 70% of the vote. And what that really tells us is everybody is touched by substance misuse or mental health, whether that's themselves, their family members, their community, their youth, at whatever level they recognize and felt that. And our charge is to really address Denver's mental health and substance misuse needs. And as I talked about, really that community engagement piece is so important. So we actually, between the months of October, middle of October and December, we connected with 1,600 people. The way we did that is we partnered with 60 community organizations that were trusted and could bring both their clients, their friends, their staff to really talk to us about what were some of the big issues. We hosted 4 forums in different neighborhoods throughout Denver. And then we did a couple of virtual events, English, Spanish only as well, and then polling to ensure that we weren't putting our foot on the pedal too much in driving. And so the initiative itself requires us to engage community to understand what our funding priorities should be. And again, we believe communities are our greatest resource, knowledge, and experience. So through that, we identified our funding areas. And so again, it was through those variety of ways we really heard from folks. And I will say we used some needs assessment that were collected by the city, by Denver Health, by Kaiser, and all of those were important. But what I'll say the biggest thing is a lot of those needs assessments are written in the voice of the system itself. Very few are written into how do I experience it as an individual. So what we did is we took those top 9, 10 needs and we changed them to I statements so that we could go to community and say, how does this show up for you? Is this your experience? Does this resonate? Does this not resonate? Did we forget something? And then we had everybody vote on what was most important. It wasn't about getting consensus within a group, but really every individual got to vote on what was the issue that was most important to me and then why. And so I put a link to our funding document because all the words underneath these areas are really what community told us, what they reflected back to us. And we didn't see differences in Spanish speakers versus English speakers versus community to community. The need was pretty resounding and it was really focused on these 4 areas. And I should say, not only did we leverage community in helping define these funding areas, but now as we've gone out in each of these funding areas, we use community to refine the vision statement. Whether that's through an advisory committee or interviews, we will get them to say, okay, this is what we were told initially. What do you think now? Where should we focus? What's important to put in this call for proposals? And then we also use community reviewers to really share their knowledge and expertise and not make decisions on the grant, but give us that important community context to understand about what will be successful and what is trusted in community. Because again, that's how you get to that bold, innovative response is really give community the freedom to say, what's gonna work for me? Because what we heard over and over again is there's many sizes fits all. There's not one pathway to recovery. It's about allowing communities and how somebody might identify, whether that be around identity, whether that be around race or ethnicity, whether that be around age, whether that be around faith. You can sort of make assumptions about a person, but really what drives a person in the recovery is where they would put themselves. And so this many sizes fits all really makes sure that there's places for everyone to choose. So the 4 funding areas, alternatives to jail, we just awarded $6.7 million in this area, largely to community-based organizations. Over 60% of the organizations we were funded were run by people of color. And we know that there is a racial and ethnicity disparity within our justice system. And we really wanted to make sure that people felt like they could get care from people that understood them, knew them. Really, again, over and over, the other part that came up through all of these funding areas was the importance of peers and people with lived experience, really helping people through the recovery through those connections. And that was especially true in this alternatives to jail space. And so it's really about greater supports and opportunities to get, with people with mental health or substance misuse, to direct them away from the criminal justice system and towards care. So we also recently launched in this what we call the STAR program. So it's a van that goes out that is a paramedic and mental health provider that is dispatched by 911. And so instead of showing up with lights and sirens when somebody's in crisis, which can then send them to, deeper into crisis, they are able to show up and get people connected to care. We've also funded co-responders, so mental health providers that ride along with police again, to divert them from the justice system. So it shows up, we're funding the system as well as community to say, we've got to be able to do this better. Community-centered solutions is our next funding area, and that's really going to be about how do we create more supports in community where people live, work, play, pray, rather than requiring them to go care someplace else, somewhere they don't trust. But this is really about creating connections. With youth, it's increasing the well-being and resiliency, and our youth is 0 to 26, because when we talk to community, it's until they come off their health insurance, they're still my child, they are still my youth. It's not early childhood, it's not this, it's not, so we have that whole bucket. And then care provision, really better support, access, navigation, cultural competency, recognizing cultural healing that also needs to be part of that model. So you can read more about our funding areas, but really this was a statement that drives us a lot. It was from one of our community members, and it's been shared over and over again in different forums as we bring community together, but it's really people recover in community. Rarely do they recover in isolation, and isolation is some of the challenge that we've heard from some of the other speakers that is driving some of our COVID needs as well. And so like many other foundations like Hog Foundation and foundations across Colorado and across the country, we're all trying to figure out how do we help community in this time. So Caring for Denver, again, was created as a ballot initiative, but we were required to be a nonprofit, separate from and distinct from the city, so that we could quickly respond to emerging mental health and substance misuse needs in our communities. And COVID was a prime example of that, was a prime example of that, where we could get dollars into a lot of our mental health and substance misuse providers' hands within 30 days of sheltering in place, to ensure that they could have the resources to continue to operate to meet the increased demands when their payment models are changing and hadn't quite changed yet to support telehealth. So some of them were having to switch to these systems without a payment structure, but they were trying to do the right thing for community, and we wanted to help them. So we did our funding in a couple different ways. We helped set up an emergency childcare program for children of providers who were defined as vital services, to make sure that they could worry about one less thing as they went into work. Funding to support self-care, as Octavio talked about, is super important within our community. And specifically for us, we funded our 9 homeless shelters, funding for their staff, for self-care, for trauma-informed care for their staff, as the homeless population tends to be at high risk. So they're losing a lot of their clients that they're very close to. And then they're also putting themselves at risk by coming into work. And so we wanted to make sure they had the dollars to keep up with that increased demand. And then again, flexible and responsible funds to those addressing mental health and substance misuse. We have a whole list of the organizations we've funded. We've probably funded close to 30 organizations, and we're continuing to put dollars out in this space to tribal communities as they are also struggling with the disparate impacts of COVID, as well as things are starting to open up and trying to keep families together. And really what I would just offer sort of towards the end is finish up with what everybody else has said so eloquently, is that the pandemic is likely to have both short-term and long-term implications for mental health and substance misuse. It spotlights both the existing and new barriers to accessing mental health and substance misuse services, and inequities in care for community. And Ben talked about a lot of these, but it's fears of illness. It's scores of people who've seen loved ones die. There are people that have lost their job. There are people that have had to shut down their businesses. People are confined to their homes, isolated from family and friends, or for some members of our LGBTQIA community and LGBTQIA youth, they might be sheltered with family that support them or don't support them, or separated from family who don't support them. And so making sure we have resources that meet their needs are really important. And then anxiety over communities reopening. Everybody is struggling now to figure out, can I send my child back to school safely? Can I go back to work safely? everybody's afraid of what it means and what those long-term impacts are going to be. And then when parents are struggling with working from home, when they do have that ability to do that, and they're trying to homeschool or take care of their children in that same place and environment. So there's just a lot of stresses that we know that are happening and will continue to happen. And so we really have to stay focused on how do we support community and raise up the voice of community to be able to address needs and find those really innovative and bold solutions to mental health and substance misuse. So thank you.
Thank you so much for that, Lorez. Appreciate the perspective from what's going on in Denver and some of the projects you're able to support there. We don't have a ton of time for dialogue and questions, but I did want to ask a couple of questions to the group, and feel free to answer if you will. So the first I wanted to throw out there is that the All-America City Awards event is attracting primarily government officials as well as just really engaged community members. So what would you say is something that either government leaders or individuals who just care about their community can do to support the mental health crisis and the complications that COVID has brought to the sort of mental health world?
So I'll start really quickly. I think the best thing you could do as a leader right now is to normalize mental health, to really acknowledge the fact that we're all in this together and that this is a challenging time for every single one of us in the United States. Now, as has been mentioned on this call, some are facing this in different ways than others. So to be sensitive of that and to use equity in reflecting your language back on that piece. But I do think it's a huge moment as leaders just to at least say the words and to acknowledge it from whatever podium you might be standing from. I think that there's power in that very basic, simple intervention.
Great.
I would maybe just add too that we have a lot of different things going on right now, whether that's trauma being experienced by the Black African American community because of some of the social injustice, historical and current, to the disparate impacts of COVID, so there's a tendency to respond to each event, but it is this larger, broader picture of trauma, well-being, and healing that you can't forget about that long-term piece in midst of trying to solve for very sort of everything in the short term. So I would just say having that long-term vision about what do we need to do to support people's well-being in that mental health substance misuse space is really important for leaders to be thinking about. So, you know, both of those pieces.
Rebecca, I would just add to great comments already by Lorez and Ben. Two things. One is really a great opportunity to continue the work of destigmatizing the access to mental health, because this is affecting all of us and the surveys are showing that. And then two, really highlighting the resources that exist, and let's take advantage of them. And really it's important for all of us to get the word out that the resources do exist. It's horrible when we have resources and nobody's accessing them because maybe it just hasn't been marketed well, or we're just not verbalizing that. And that's a role that our leaders can definitely do, formal or informal leaders, because there's leaders in communities that can do that as well, right? Which is just so critically important. And just being that we're all, you know, on the same page, getting these resources out to everyone, and recognizing it is for everyone, because I really do think here we have an opportunity to really destigmatize what has happened to historically the use of substance use and mental health services.
Absolutely. Thank you for those thoughts on actions that leaders and just people who care about their community can do here. I want to wrap us up by asking a sort of parting question. What does success a year from now look like, and how did we get there together?
Well, success, I mean, it depends on which level we're looking at here. I mean, it'd be great to get more tests and get people results quicker and have more PPE, all that stuff. I mean, I think there's some success in that. I think from a mental health perspective, probably from my perspective, one of the most important things that we could have for success are some of the things that Jonah lifted up. If this Congress decides to take meaningful action for mental health and put, you know, substantial resources behind it, we actually could bring forward some new and innovative ideas on restructuring how we deliver mental health in this country. If we tinker at the edges and just do a little bit here and a little bit there, it won't be as great. So I think that this is a moment for us to really be bold in our vision and bold in what Congress could do to invest. I think that could lead to some success.
And I'll probably just say, we're going to be bold in community, and ideally we'll learn things that can sort of also make its way up so that they can be best practices for other states, for the country, about how do we respond to and how can we better address mental health and substance misuse so that people get the care at the right time in the right place and don't have to wait until they're in crisis and sort of have a touch with the justice system or the fire, things that will make their mental health worse. So we can do better. And I hope in a year we are doing better, that COVID has given us that opportunity. I mean, we've talked about telehealth, but I just want to echo why it's been so important is it means people can access their services so much easier because they don't have to find childcare. They don't have to worry about transportation. They can make a call. If they have the technology, they can jump on a line and they can get the help they need, right, in a place that they're comfortable. And that is so important for access. And it's something we should have done pre-COVID. And COVID has given us that opportunity to, and it's not for everybody, but for those that it works, we need to make sure that that continues and that avenue to access is maintained.
Rebecca, could I just add, because great comments, and to me, success would also include that we're learning from our experience to really include all our community members, especially those that have been historically marginalized or excluded, so that we really are moving truly toward equity for all. That would be, I think, just a fabulous, metric that maybe we could identify and continue to incorporate, because that will result that it's the tide that lifts all boats. If we take care of our most underserved, the most needy, we all actually win.
Dovetailing off the boat reference, I think of America as kind of this big tanker where we can't go 180 or else we capsize. We have to think, how do we shift it to a better direction? And I think a year from now, off the top of my head, we'd have a 3-digit suicide prevention lifeline number. We'd have massive investments on the federal level in mental health services, billions of dollars scaling up programs like the Garrett Lee Smith suicide prevention program. We would also invest heavily in recovery and treatment. We've done a lot in expanding MAT, but also recovery. Recovery is a long, hard-fought thing for people dealing with substance use disorders. It takes a lot. Relapse is a common thing. So how do we build upon that and make sure that we're giving them the resources they need? But I think just the investment in money, 3-digit lifeline number, and also some of the programmatic changes I highlighted, I think that's doable within a year without totally capsizing the boat. I know it's a troubling metaphor.
Well, thank you all for those parting thoughts. A big theme throughout today has been the importance of technology, making it accessible and utilizing it correctly. And you guys have all been doing that today by participating in our virtual conference. And I really appreciate you taking the time to speak on this important topic. And we will continue the fight for this, and with all of the 4 of you leading the charge, I have no doubt that we will have some successes here in the next year. So thank you all again.